This is Nephrology Nursing Perspectives, the official podcast of the American Nephrology Nurses Association.
Hello, everyone. This is Lillian Pryor, your Nephrology Nursing Perspectives host, and I am here today with another fantastic guest. Our guest today actually hails from California at the School of Medicine, UCLA. He's board certified in nephrology, doctoral degree in pharmacology, and he also has a terrific program. It is the UCLA Core Kidney Health Program. Without further ado, so I can get right into asking him a bunch of questions, and he can give us all of the answers and just tell us a little bit more about himself. It is my pleasure to introduce to you Dr. Anjay Rastogi. Welcome, Dr. Rastogi. How are you today?
I'm great, Dr. Pryor, and it's a real privilege and honor to be here. So thank you so much for inviting me to share my thoughts.
Absolutely. You were actually mentioned to me by a common friend of ours, Kristen Larson.
Yes.
And she had so many good things to say about you. But I also had a little bit of insight, not specifically Dr. Rastogi, but we'll talk about it in a little while, that core kidney float at the Tournament of Roses parade. And so we're going to take a step back, first of all, and I want you just to introduce yourself to the audience. Give us a little bit of background and what brought you into nephrology.
Wonderful. So I was born and raised in a town called Jaipur in India and finished my medical school there. And after that, it struck me that learning about medications and drugs is very vital for my career as a provider and a physician. So I started looking for doctoral programs, a PhD program. Mm-hmm. And the best one at that time, this is now going back to 1994, was at UCLA, the Molecular and Medical Pharmacology program. And I had the privilege and honor and just, I would say, I don't believe in luck, but I would say here to end up in the lab of Dr. Louis Ignarro, who actually went on to win the Nobel Prize in 1998 for medicine and physiology. For the work that he did was very seminal in cardiovascular disease. Mm-hmm. And the reason why I give this a bit of a background is because my initial, just the way my research was going was to go into cardiology. That was going to be my focus. And that's what, I think was planned for me as well. Mm-hmm. But once I did my nephrology rotation in my third year of my residency at UCLA, I really fell in love with renal physiology, renal diseases, but also it gave me a chance to take care of the patient as a whole, because as we know, kidney disease tends to affect every single organ, including the cardiovascular system. Absolutely. So that was my into nephrology. And then, I became faculty at UCLA in 2005. So I've been at UCLA since 1994. So as they would call a true Bruin.
That's wonderful. And listen, I've heard from so many people that once you're introduced to nephrology, you either love it, right? Or you hate it. So we're so glad that you loved it.
and the nurses were one of the reasons why I loved it too. And I'll get into that in a bit more.
Okay. All right. So now I wanted to we're going to touch just a little bit on, if you don't mind, we'll start with your core kidney health program. Mm-hmm. And tell me a little bit about how that came to be, its inception, and what your vision is for that program.
Wonderful. So CORE stands for C is clinical excellence and comprehensive care. That's the C. O is for outreach, R is for research, and E is for education. Okay. So very early on in my medical training in the US at UCLA, but in this country in general, I found out one thing was very clear, that number one, the care was fragmented. Mm-hmm. Number two was it was reactive rather than proactive, that you go, if you have a heart attack, you go and get your stents placed in rather than prevent, the atherosclerosis to happen. The third was there was no team approach to care. And by the team, obviously, is our MDs, our NPs, PAs, nurses, and all the healthcare pharmacists and stuff, but also the patient and their family. That is a part of the team that I call person-centric care, not just patient-centric. So
Yes.
that was always on my mind, Dr. Pryor. And we know, and I felt it right away, that we can do better. I mean, the care, if you look at in the US, is excellent, if you really can get it, number one, and the quality. But the problem that I have is it's getting very expensive. And since it's such a burden and we are so reactive, we are way behind. And that was the genesis of CORE, where we wanted to focus on, besides clinical excellence, on comprehensive care, which is team approach. I'm a true believer in team. And
Yes.
then outreach, research, and education. And you mentioned Kristen Larson, who's a dear friend of mine. And I didn't know her. I was just attending one of her presentations, and she is so, she gets the message, and a very dynamic speaker. She speaks her mind like I do. So I was very impressed. So, but education. I think that's really critical, involving the family. And that was genesis of our CORE program, which is really the four things. But now it has evolved, even beyond. And I would say technically have two arms. One is the academic arm that sits at UCLA. And then there is a patient advocacy arm, which is a nonprofit foundation, which works to help the UCLA CORE program. So it's doing very well because of people like you, Dr. Pryor, for people like your CEO, Michelle Campbell, and also Kristen and everybody else. So very grateful.
Yes. Thank you so much. And you mentioned a couple of things that I just want to touch on a little bit. Clinical excellence for reactive care. Yes, we kind of have that down pat, but we have a bit of a ways to go in terms of preventive care.
Yes.
And I was speaking to another guest, and she is a futurist, actually. And what she kind of brought, I guess, more to my attention was just what you're saying. We need to be more upstream in terms of how we're identifying chronic kidney disease and how we're also getting that education out to folks, right? Before they actually end up in a situation where they are now considered end-stage renal disease and needs renal replacement therapy, which brings me to that part of your core, the research part. What about that research part, and what steps are you taking in your research development or development of research in terms of this preventive focus?
So I think that's an excellent point, Dr. Pryor, and the ways you summarized it. And I'll come back to some of the points that you're mentioning.
Okay.
But let me talk about research. So I have a PhD. I went into pharmacology. Like I said, it struck me very early in my medical school days that we as healthcare providers need to learn more about drugs. And we can't be drug pushers. We shouldn't be. And drugs should never be a substitute for lifestyle changes, because that is a slippery slope. But having said that, if you need the drug and medication, you should take it.
Right.
So my focus is quite broad, but we do a lot of clinical trials. A lot of the drugs and medication that we worked on are now actually on market. And there's so many other drugs, and our big focus is IgA nephropathy at this time, which is the most common GN, but also nephrogenetics. We started these programs at UCLA, 15 years ago, when people were not even thinking. We have the ADPKD program, Fabry's, Alport's, and the list goes on and on, ESKD care. We're also focusing on outcomes, value-based care, and parting of kidney care first. So more comprehensive approach to, and not just drugs and medications, but also outcomes. We're starting registries within UCLA Health that the big focus is going to be on quality assessment and improvement. So we think we are doing very well. I think I provide fairly decent care to my patients. It can always be better, but am I really, right? So, and the data doesn't lie, like my mentor, Professor Ignaro would always say. So we are trying to look at the data and see, and leveraging the electronic healthcare system to see if we are really. So somebody asked me at the National Kidney Foundation, I was just there, if there's one thing that I can focus on, because all the things that I'm mentioning, and I can tell you the thing that I want to focus on is GDMT, Guideline Directed Medical Therapies. And we do a lot of research. Of those research guidelines come out, and those guidelines should be implemented. But if those guidelines are not implemented, Dr. Pryor, there is no benefit. We can keep on doing research and research and research, but it doesn't trickle down to the patients and their families. What good is it, right?
Exactly.
So
Exactly.
how do we implement these guideline-directed medical therapies? And that's really what I want to focus on for the next couple of years. Besides all the trials and research what we're doing, and just to put things in perspective, we want to get into the stem cell research. We want to go into regenerative medicine, but that's a few steps down at this point.
Excellent. And very, very good points. We need something, like you said, that we can use now. And the GDMT, what you're talking about, sounds like something that would not only be a quicker, I don't want to say solution, right? Because we're far away from a solution, but something that would standardize, if you will, or kind of have us all on the same page. So we're all kind of following the same kind of guidelines, and we're focusing all of our efforts on that patient-centered outcome. And we're kind of all doing the same thing. Like I think you mentioned earlier, that healthcare is fragmented, and we have to work together toward kind of focusing preventatively on that patient. And you mentioned family. You talked about families over and over. And so we know that when a person has chronic kidney disease, it's not just that person, it's that whole family, and sometimes that whole community, right? So
Absolutely.
Go ahead.
I was just agreeing with everything that you're saying. That is sometimes when we see patients on dialysis, who brings them in, who takes them home, who takes them to the hospital. So, and my other focus, and we'll be talking about the float a bit, but living kidney donors, what a priceless gift. And I always say when a human being gives, whether it be deceased or living, they're not just helping a patient, Dr. Pryor, they're not just helping a family, they're helping society. Because guess what? Who's paying for all this? We are.
We are. Exactly.
7%, Dr. Pryor, of the budget of Medicare goes towards patients that suffer from advanced kidney disease, and they account for less than 1%.
Yes.
And diabetes is half of the cause that patients end up with end-stage kidney disease. So if we care of diabetes upstream, like the word that you had used, Dr. Pryor, right? Upstream, we can cut off a significant number of patients. And that's what GDMT is, whether it be RAS inhibitors, SGLT2, MRAs, whatever it is. So this is very important. Just a couple of things that before I forget, I want to say is also no one should be left behind, Dr. Pryor. We live in this society that there are a lot of inequities. And, this is a great country. I'm an immigrant here, and I love this country. I love what it stands for. But there is still inequities, probably less than other countries. We don't think about that, but still it is quite big, the gap. And we need to narrow that gap. And also, the focus of CORE is to make patients their own best advocates. Because if their patients understand the disease state and can advocate for themselves, the quality of care, Dr. Pryor, gets better on an average. So that's the least. So education, education, education.
Yes, yes. And what we're doing, Dr. Rastogi, is we are actually, when you empower our patients or those persons that, that have been diagnosed with chronic kidney disease, it kind of makes us a little more accountable, if you will, right? So if I come into a dialysis facility and I'm working with a patient who is on hemodialysis, and say, for instance, this would never happen, but say I don't check the access, I don't do an assessment of the access, that patient should have the empowerment or should be able to say to me, wait a minute, hold on, aren't you going to assess my access before you put needles in there? Or something like that. And you're talking about that education. And so we have to educate our patients, but also empower them and let them know, we need to be held accountable too as healthcare providers. And, that's a whole nother,
and it's coming.
lecture, but
Dr. Pryor, it's coming. It's called value-based care, right? The providers will be held accountable. Like you said, why isn't this patient on home when they couldn't be at home? Why is this patient not transplanted? Why are they not on the right medications? Those are all checks and balances that are coming and will be in place, in which, if you don't perform by standards, you probably will get dinged on your payments. And I would agree with that. I
Yes.
think that's but education, like you said, if the patient, have you changed my dry weight, right?
Right.
I just got discharged from the hospital. Have you looked at my discharge summary? Those are all questions the patient should ask. But they should be knowledgeable as well, because sometimes you
Yes.
start asking questions that just don't go anywhere. So
Right. All right. So let's change gears a little bit. And let's just take it on the lighter side. I want to talk about how you came to have a
yes.
vote in this tournament of roses parade. How did that come to be?
Yeah. So first of all, Dr. Pryor, your husband played in Rose Bowl. Your son played in Rose Bowl, and you are the first person who said it correctly. It's a tournament of roses parade, right?
Yes.
And the Rose Bowl and the Rose Parade are part of it. Because a lot of people, they don't, but that is so. It's two parts of the tournament of roses. But the story is a bit. My uncle, who unfortunately passed away last year, and he was like my father. He went to Caltech, 1960. He was 20 years old. He came straight from India and was a top scientist, engineer, aeronautical, and he was in Pasadena. So I heard back in India stories about Rose Parade. He would always tell us about Rose Parade. He wasn't that much interested in Rose Bowl because he wasn't into football, but Rose Parade. And when I came, the channel KTLA 5, I think that's where they play it. It's just looped. It plays throughout the day.
Mm-hmm.
And then last year in March, Nanette Zumwalt, I mean, and this is all, there's no HIPAA violation here, but it's a public. But Nanette Zumwalt is one of my patients. Actually, her family is my patient. They have ADPKD. And her husband is Rick Zumwalt. And Rick has a very interesting career. He, like I mentioned to you before this program, that he himself played in Rose Bowl in 1987 for ASU. And then he became a law enforcement officer. Actually, he was a sniper trainer. And then he became a neuropsychologist. And all these things are important when I get into. So in March of last year, he calls me up and says, Dr. Rastogi, I need to talk to you. And I said, sure, Rick, what's going on? And he says, you keep on repeating the same numbers. 1 in 3 are at risk. 1 in 7 have it. Only 1 in 10 know it because it's a silent disease. So all those facts, keep in mind, he's a neuropsychologist, right? So his question to me, what are you guys doing? And he says, I know CORE is doing a lot of things, but what are we doing nationally to change these numbers? I keep on hearing the same thing, the needle is not moving. And I said, it's not that easy. It's a complex process. Human behavior doesn't change that easily.
Right.
And then he says, I have a suggestion. And I said, what's your suggestion, Rick? We should have a float in the Rose Parade. And I waited for a couple of seconds. And then I said, Rick, I'm going to call Nanette, his wife, and tell her that you're a bona fide crazy person and you're wasting my time. And he says, Dr. Rastogi, hear me out and I says, no, I don't have, this was not on my radar.
At all.
So, and I said, you know what, don't waste my time. I have patients to see, I've researched, I have admin job. And he says, just give me. So it took him 3 months. This is March and now we are in July. And he convinced me that we should have a float. Now I'm the crazy one. I'm telling everybody who's going to have. So then I went to UCLA Health, and UCLA Health, it's a great idea. They're very in the community, but they couldn't come up with the compliance and all that in the time. So we had a core kidney float, which is core kidney, like I said, is a nonprofit that works with core kidney at UCLA, very, very close. And that was a genesis. But what I found, so it was a very complex process, and everybody was saying, don't do it. We do it in 10 weeks, Dr. Pryor, 10 weeks. And you know about the Rose parade and stuff. But the energy, first of all, I also want to say working with the Tournament of Roses was just so uplifting. I mean, they're just wonderful. It's a very positive, clean, and just great people. It's all about, then because we have the Macy's parade here, we have all that, but this is just people, when people are there and the people who worked. So it just, and we kicked it off, and our statement was, and this is where we had to spend a lot of time, is we're honoring our living kidney donors by increasing kidney health awareness. And they were living donors walking and riding. And I said, these people gave a part of their body, put their life at risk. The least we can do is do a simple urine test and a blood test to identify kidney disease. And we are going to have another parade in 2025. So we are already a part of the float and parade, and you'll see the core kidney float there too. So, and obviously I'm working with Anna, at the whole national level. But if anybody wants to participate, help get the word out, actually we will be reaching out to Anna, Dr. Pryor, as we spoke about once we get closer.
Yes.
But yeah, so that was the genesis, and we won the Isabella Coleman Award. Now, it's very rare to win an award in the first year, actually in 10 weeks time that we put in. But Isabella Coleman, a lot of people don't I didn't know who she was, by the way. She was the first woman florist designer for Rose Parade. So she's held in very high esteem within the Tournament of Roses. So it's a very prestigious award, I was told, that Tournament of Roses gives out to their select people. And the whole thing, and I'll stop at that, was kidney health awareness. So there's a float coming down first of the year, and we all make healthcare resolutions. And this is the time to say, I'm going to get tested.
Yes. Perfect. And this is a perfect example, Dr. Rastogi, about thinking out of the box, right? Just by your own admission, sometimes we don't think about those other possibilities. And it's just, we really have to kind of think outside. And when we talk about awareness and on such a national level, like what better place? What better place and what better time, right, to do it? And so it takes somebody sometimes from the outside looking in to say, hey, why aren't you doing this? And for us to be willing to kind of take that. You took a little bit of convincing though, but that's okay. You got it. And we are glad you did. It was wonderful. There was coverage. And I know just in the last couple of years, I guess not related to core, but maybe related to core, we are seeing now, all of these commercials coming on, right? With, you don't want to be here with chronic kidney disease and, all of these commercials talking about chronic kidney disease. So I'm hoping that people are really paying attention, and that mindset, our mindset sometimes is so hard to change the behavior that we're doing. And hopefully these things that we keep seeing it on TV and it's commercials and when now we have the floats in the Tournament of Roses parade, that it just keeps reminding us we need to change our behavior and get ahead of this and be preventive about it. And that's kind of the crux of what we're trying to do. And so it takes, you mentioned a team, and so it takes all of us. But there is a special relationship, and I want you to talk a little bit about that before we wrap up, though. But the relationship between nephrologists and the nephrology nurses. Tell me a little bit about your experience or just your thoughts about that.
Thank you, Dr. Pryor, for letting me speak on this. And I would go even one step above. It's not just nephrology nurses, it's nurses in general. Mm-hmm. And I will just tell you my experience when I was in training as an intern, as a resident, as a fellow, and even as a junior faculty. First of all, one thing that struck me was nurses, it takes a special person to go into the nursing career. I mean, there's a lot of physical and mental stress that goes with it. We think we get mental stress. They deal with that throughout the day. And who do the patient spends time with? Is the nurses. Yes. And a good nurse has such a good, significant impact in the quality of care, not just because they watch the medical care, but also the support they provide to the patients. Mm-hmm. So for me, when I was in training, it was my favorite time of the day was when I went into the hospital. The first thing I would do, I was reach out to the nurse who was on the night and say, how did the patient do? And they would always give me tidbits here and there. Yes. And it just became a special relationship. I would learn from them and I would share what I thought was important for them to know as well. But then I went into my, nephrology, and that's where I really got a chance to work with our dialysis nurses. Mm-hmm. Now, keep in mind, these dialysis nurses was when I was in training, this is in 2003, 2004, they are the one who started dialysis. Dialysis was in the medieval time in the 70s and 80s and 90s even, right? Yes. So they put everything together. They honestly knew a lot more than some of the nephrologists would know about these machines and care. And I spent a lot of time with my dialysis nurses learning about dialysis and about all the different facets and stuff. So my appreciation for the nurses in general, but especially our nephrology nurses, was just went through the sky. And I said, it is such, and I honestly think that they never got the due attention and respect what they deserved. And they still don't, but that's not what they work for. I mean, they don't work for attention. They don't work for, they work because they really love their job. And I can see that. So the connection was very deep, Dr. Pryor. And then I got a chance to work with some of your colleagues. Kristen Larson is one of them that I've been working with. And then I met your CEO, which I think is just a breath of fresh air. And I'll be working very closely with Anna. I'm a member of Anna now, active member.
Excellent.
And I'm going to the Hill with you guys to advocate for
Yes.
for all that Anna stands for.
In
And
June, yes.
in June, yes, we'll be in DC, and also the other potential collaborations, educational stuff, and training, and getting new nurses involved. You know, the same problem that we have in nephrology MDs, that the pipeline is not that strong. Same thing I'm seeing in our nephrology nurses. We need to get that back, Dr. Pryor. We need to get the excellence back over here, the interest. You know, how can we make it more attractive, right?
Yes.
That
Yes.
people not just come to nephrology, but stay in nephrology.
Absolutely.
And I think it's our responsibility now to keep that pipeline going.
Oh, thank you. Thank you. And I appreciate that and your comments so much. And it does, it's a work of heart, and just the knowing, I think, you mentioned earlier that, kidney disease, it touches every single system in the body is going to be touched if your kidneys are not working like they're supposed to. And so taking care of that whole person that's been diagnosed with chronic kidney disease, regardless of, where it may have stemmed from. You talked about the IgA nephropathy, FSGS, right? And now most recently, we're talking about the APO, what is it? The APO
APOL, yeah.
1, right? And so we're finding all of these things that can contribute and increase your risk for chronic kidney disease. Something like diabetes, where many of the what I want to say behaviors or the risks are preventable. We definitely need to get that word out and to kind of convince folks there's another way that you can live, and you talked about equity. It's not just for this person over here or this person over there. We all can make these lifestyle changes that can affect to decrease our risk. And so I just loved everything that you said today, and it was such a pleasure to get to speak with you. I hope to get to meet you.
I hope so too. I really hope so. We didn't get a chance to talk about the brewing beans.
Yes, please. Let's finish up with that.
Yeah, it's very dear to my heart. So Bruin Beans Health Club. So Bruin is UCLA, Beans is kidneys, and we started an undergraduate club. It's an official club, health club at UCLA, and it's a very popular club, very exclusive club. We keep the membership between 2025 total for all the years. And graduates from this club are now in medical school. Some of them are even in fellowship. They are pharmacists, they're nurses. So it's something that we want to give back, and giving them a very structured exposure, like what I saw when I was a fellow. Hopefully they can see it earlier and go into not just into the health field, but also in kidney disease. So they are a big part of what we do on a daily basis. And they are a part of the core kidney program. It's a wing of, and also participating in all our outreach. They were at the float as well, walking there in support. So a wonderful group of people.
Oh, that's amazing. That's amazing. And it sounds like just community involvement, right?
Yep. Yes.
Being out there in the community and working with the community because, like it or not, people also get their information and some of their advice and stuff from out in the community. And so that's where we need to be, just again, to educate those in the community and put forth that education and that clinical excellence. We can do both. We should be doing both and provide that health equity for all of the communities and just increase that awareness for chronic kidney disease and how to prevent that.
Yep.
All right. Well, listen, I want to thank you again. Any final words before I wrap up this wonderful podcast?
Yeah. No, thank you so much. I appreciate you, Dr. Pryor and Anna. So thank you for having me today.
Absolutely. And we are certainly glad that you are a member of ANNA. I say thank you again to Dr. Anjay Rastogi for joining us today on this ANNA podcast. And everyone take care. Please listen in to wherever you listen to your podcast. Thank you, and bye-bye.
Nephrology Nursing Perspectives is owned and produced by the American Nephrology Nurses Association, all rights reserved. No portion of this podcast may be used without written permission. Dr. Anjay Rastogi is a professor and the Clinical Chief of Nephrology at the David Geffen School of Medicine at UCLA, Los Angeles, California. Dr. Rastogi founded and is the director of the UCLA Core Kidney Health Program, which is based on the core values of clinical excellence, outreach, research, and education. Heavily involved in research, Dr. Rastogi also serves as the director of the Nephrology Clinical Research Program and multiple other programs at UCLA. To discover more about the Core Kidney Health Program, please visit uclahealth.org/programs/core-kidney or on Facebook at facebook.com/corekidney. Dr. Lillian Pryor is Dialysis Program Manager at Encompass Health Rehabilitation Hospital of Henry. A member of the American Nephrology Nurses Association since 1990, Dr. Pryor has served in roles that include President-elect, ANNA Director, ANNA Awards and Scholarships Committee Chairperson, ANNA Representative to the Kidney Health Initiative Patient Preference Task Force, and an author and peer reviewer for the Nephrology Nursing Journal. Dr. Pryor served as the 2020-2021 president of the American Nephrology Nurses Association. In addition, she is an active member of ANNA's Dogwood chapter in Georgia and has served the chapter as both its president and health policy representative. For archived episodes of this and all ANNA podcasts, and to learn more about the American Nephrology Nurses Association, visit annanurse.org. You can subscribe to Nephrology Nursing Perspectives everywhere podcasts are found.